the next principle is about treatment of random and systematic effects. And the principle says that random and systematic effects are treated the same way. It is principle number 4. And let us look at this principle on the example of pipetting that we did in one of the previous lectures. Here we had different uncertainty sources, namely 3 different uncertainty sources: uncertainty due to repeatability, uncertainty due to calibration of the pipette, and uncertainty due to temperature. Let us think which of these are related to random effects and which are related to systematic effects. So, obviously, repeatability is a random effect by definition, because it takes into account the small differences that occur from pipetting to pipetting. So this is random. Effect. Now, this calibration uncertainty, if we use the same pipette for the different pipetting operations, is a typical systematic uncertainty source. Because if the mark is a little bit off from 10 milliliters, then it remains off for all those pipetting operations. So that calibration effect is a typical systematic effect. Now, temperature is more tricky than any of these two. If the temperature during the day remains constant, then it is a typical systematic effect. However, if the temperature changes from measurement to measurement, then it actually becomes a random effect. So the temperature can be either a random or a systematic effect. And in spite of these effects being different by their nature, they are still all accounted for exactly the same way. All these contributions are estimated, converted into standard uncertainties, and standard uncertainties are then combined. It is important to stress that those concepts, random and systematic, are in fact not absolute concepts. An effect that under one set of conditions is systematic can under different set of conditions be a random effect. For example, as long as we do pipetting using the same pipette, this calibration effect remains a systematic effect. But if for every pipetting operation we take a new pipette, then in fact the calibration uncertainty becomes a random effect, because in some cases the mark is slightly below, in some cases slightly above 10 milliliters. And how systematic effects can be converted into random effects by changing conditions will be explained in a coming lecture.